Welcome back to the channel. Today, we're diving into a topic that affects millions of people worldwide: diarrhea. It's something we often experience, yet might feel embarrassed to discuss openly. But understanding diarrhea is crucial for managing it effectively and preventing potential complications. We'll cover everything from what causes those uncomfortable, loose and watery stools, to how you can get relief and when it's time to see a doctor. Now, I know talking about bowel movements isn't exactly glamorous, but trust me, this information is important. Whether you're experiencing diarrhea yourself or want to be prepared for when it strikes, this video will give you the knowledge you need to take control of your gut health. We're going to break down the science behind diarrhea in a way that's easy to understand and provide you with practical tips you can use right away. So, grab a glass of water. Hydration is key when we talk about diarrhea. And let's get started. We'll explore the different types of diarrhea, what triggers them, and how they impact your body. By the end of this video, you'll be armed with the knowledge to tackle diarrhea head-on and get back to feeling your best. So, what exactly is diarrhea? Simply put, it's characterized by frequent loose or watery bowel movements. We're not talking about your occasional slightly softer stool, but rather a noticeable change in consistency and frequency. This can range from a few loose stools a day to many more, significantly disrupting your routine and comfort. Now, diarrhea can be classified as either acute or chronic. Acute diarrhea is the most common type and typically lasts for a short period, usually less than 2 weeks. It's often caused by a viral or bacterial infection, sometimes even something you ate. Chronic diarrhea, on the other hand, persists for 4 weeks or longer and may signal an underlying digestive issue that requires further investigation. Conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, can be culprits behind chronic diarrhea. It's important to distinguish between the two because the approach to treatment can vary. While acute diarrhea often resolves on its own with supportive care, chronic diarrhea requires a more in-depth approach to identify and address the root cause. Pay attention to the duration and characteristics of your diarrhea to help determine whether it's a passing inconvenience or a sign of something more serious. And remember, while diarrhea itself isn't usually a life-threatening condition, its potential complications, especially dehydration, can be serious. Diarrhea can be triggered by a wide range of factors. One of the most common culprits is infection, often caused by bacteria, viruses, or parasites. These pesky microbes can disrupt the delicate balance of your gut, leading to inflammation and increased water secretion in the intestines. Food poisoning, traveler's diarrhea, and even the stomach flu are classic examples of infection-induced diarrhea. Another common cause is food intolerance. This occurs when your body has difficulty digesting certain substances, like lactose or gluten. The undigested food can irritate the gut lining and draw water into the intestines, resulting in diarrhea. It's important to distinguish food intolerance from a food allergy, which involves the immune system and can be more severe. Certain medications can also have diarrhea as a side effect. Antibiotics, for example, can disrupt the gut's natural bacterial flora, paving the way for diarrhea-causing bacteria to flourish. Other medications, like antacids containing magnesium, can also have a laxative effect. Finally, underlying digestive disorders can contribute to chronic diarrhea. Conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, celiac disease, and even certain types of cancer can disrupt the digestive process and lead to persistent diarrhea. When you have diarrhea, your digestive system isn't functioning as it should. Normally, your intestines absorb water and nutrients from the food you eat, leaving behind semi-solid waste. But when diarrhea strikes, this process gets disrupted. The lining of your intestines becomes inflamed or irritated, preventing proper absorption of water and electrolytes. Think of your intestines as a sponge. A healthy intestine efficiently soaks up water, leaving behind a properly formed stool. But with diarrhea, the sponge becomes less effective, allowing excess water to pass through undigested. This leads to the characteristic loose, watery stools associated with the condition. This disruption can be caused by a variety of factors, as we discussed earlier. Infections can introduce harmful bacteria or viruses that damage the intestinal lining. Food intolerances can trigger an inflammatory response, further hindering absorption. And certain medications can interfere with the normal digestive processes. The result is an increased frequency of bowel movements, with stools that are significantly more liquid than usual. This rapid transit of waste through your digestive system doesn't give your body enough time to absorb the necessary fluids and electrolytes, leading to dehydration and potential complications if left untreated. While an occasional bout of diarrhea is usually not a cause for major concern, prolonged or severe diarrhea can have significant consequences. The most immediate and serious complication is dehydration, which occurs when your body loses more fluids than it takes in. Diarrhea essentially flushes water out of your system, along with essential electrolytes like sodium and potassium. Dehydration can manifest as dry mouth, excessive thirst, decreased urine output, fatigue, and dizziness. In severe cases, it can lead to confusion, rapid heart rate, and even shock. This is particularly dangerous for vulnerable populations like young children and the elderly, who are more susceptible to the effects of dehydration. Beyond dehydration, persistent diarrhea can also lead to nutrient deficiencies. Since your intestines aren't absorbing nutrients properly, your body can become deprived of essential vitamins and minerals. This can contribute to weakness, fatigue, and a weakened immune system. In some cases, chronic diarrhea can be a symptom of a more serious underlying condition. Conditions like inflammatory bowel disease or celiac disease can cause persistent diarrhea and require specialized medical attention. If your diarrhea lasts longer than a few days, or if you experience severe symptoms like bloody stools or high fever, it's crucial to seek medical advice. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips and information. We've covered a lot of ground today, from understanding what diarrhea is and what causes it to exploring its potential complications and how to manage it effectively. Remember, staying hydrated is key when dealing with diarrhea. Replenishing lost fluids and electrolytes with oral rehydration solutions, or even just plain water, can help prevent dehydration and speed up your recovery. Pay attention to your body's signals and don't hesitate to seek medical attention if your diarrhea is severe, persistent, or accompanied by alarming symptoms. Taking care of your digestive health is crucial for overall well-being. By understanding the ins and outs of diarrhea, you're better equipped to manage it effectively and prevent potential complications. Stay healthy.